Welcome to Hematology Oncology at Arkansas Children's Hospital. As a caregiver of a child with cancer, it can be challenging to understand all aspects of care. One of the best ways to manage your child's condition is to use the Hem-Onc bag you are provided to keep all care items in one place for any situation. Contents of the Hem-Onc bag include your child's medications, list of medications currently taking, central line care card, central line care supplies, caregiver handbook, and other appropriate supplies. Carry this bag with you at all times. In order to receive chemotherapy, it is necessary for your child to have a central line, such as an implanted port, a PICC line, or other type of external line. The central line is a crucial part of the care for your child. However, it can be a source for life-threatening infections. Bacteria inside the line can enter the bloodstream and make your child very sick. Proper use and care of the central line is important to prevent infections. The following are things that you, your child, and the care team should do to help prevent an infection. Always handle the central line with care. Wash hands or use hand sanitizer regularly. Do not play with the dressings or tubing. Keep the tubing off the floor. Keep tubing out of diapers and underwear. Use appropriate cleaning techniques prior to entering the line. Minimize entries into the central line. Your child's care team may combine giving medications, drawing labs, and flushing the line when possible. You can help the care team accomplish this by encouraging your child to take medications by mouth. Remove the central line when it is no longer needed. Your medical team will discuss with you to determine the appropriate time to remove it. As the caregiver, it is important to recognize breaks or problems in the central line. Signs of a break in the tubing include wetness or bleeding under the dressing or along the tubing, puffiness around the skin near the central line, or bulging of the central line. If there are signs of a hole or tear in your child's central line, clamp the tubing. The clamp should be kept in the Hem-Onc bag for easy access. Do not try to fix or reconnect the tubing yourself if it becomes disconnected. Go to your nearest emergency department when any break in the line occurs. It is also important to recognize the signs of infection. Signs of infection usually include redness, warmth, tenderness, and/or pain at the port site, drainage or odor around the central line insertion site, unusual swelling of the face, neck, chest, or arms, chills or sweating, drowsiness, dizziness, or excessive lethargy. And one of the most important signs of infection is a fever of 101 degrees Fahrenheit or 38.3 degrees Celsius or greater. Normally, fever in a child is not too concerning as fever is the body's way of fighting infection. However, fever in a child with cancer can be deadly and is an emergency. After a child receives chemotherapy, their white blood cell count is lower than normal, also known as neutropenia. Their immune system cannot fight the infection. When a child with neutropenia develops a fever, the child needs immediate medical attention. If you think your child has a fever, take their temperature. If their temperature is 101 degrees Fahrenheit or 38.3 degrees Celsius or greater, write down the time and temperature. Then grab the Hem-Onc bag and go to your nearest emergency department. If your child does not have a fever but shows other signs of an infection, still go to your nearest emergency department. Come to the emergency department at Arkansas Children's Hospital if you live close enough, or if you have been instructed to do so by your Hem-Onc care team. Upon arrival at the emergency department, immediately check in and explain to the nurse that your child has cancer, is receiving chemotherapy, and has a fever above 101 degrees Fahrenheit or has other signs of infection. Share the time the fever was recognized and any medications that have been given. Please also let the emergency department staff know about any additional medicines your child is currently taking. You should be quickly taken to an emergency treatment room. Once in the treatment room, the emergency department medical staff will aim to provide a focused physical examination, draw labs, and start IV antibiotics within 1 hour. If your child is sick enough, it will be necessary to start one or more peripheral IVs instead of waiting for the port to be accessed. Do not hesitate to ask questions or alert other team members if you feel concerned about significant delay or if there is a change in your child's condition. If your child has fever with neutropenia or any other infection, your child will be admitted to the hospital for IV antibiotics. If you are being treated in the Arkansas Children's Hospital Emergency Department, the ACH Emergency Department team will consult with the ACH Hem/Onc team, and a bed request will be placed with admissions. Bed availability and the severity of your child's symptoms will determine the appropriate unit. Sometimes your child may be admitted to the Pediatric Intensive Care Unit, Intermediate Care Unit, or another unit for close monitoring. To review, the 4 keys to fever neutropenia are: recognize the fever and time of fever. Grab your Hem/Onc bag and go to the emergency department. Identify yourself and your child's diagnosis to the emergency department receptionist. Be an advocate for your child. Whether at home, hospital, in clinic, or at the emergency department, this video outlines the best ways to manage your child's condition. We thank you for your attention and for choosing Arkansas Children's Hospital, where we're committed to providing you and your child the highest quality medical care. If you have any questions, please contact Hematology Oncology at Arkansas Children's Hospital at 501-364-1100 after hours or 501-364-1494 during regular business hours.